Have you ever looked in the mirror and thought, my teeth look longer than they used to? Most people blame age, some blame genetics, others think maybe that's just what happens as you get older. But what if I told you that one of the most common causes isn't aging at all? It's something millions of people do every single morning without realizing they're slowly damaging their gums. Ironically, they're trying to protect their teeth, but instead, they may be wearing away the very tissue that keeps those teeth healthy. Today, I'd like to show you one brushing mistake I see almost every day, and how a simple change could help protect your smile for years to come. Hello, I'm Dr. Daniel Brooks. After more than 30 years as a family dentist, I've noticed something interesting. Many patients who care deeply about their teeth accidentally damage their gums. Not because they don't brush, but because they brush the wrong way. The good news? This habit is surprisingly easy to fix once you know what to look for. Let's start with the biggest mistake of all. Mistake number 1. Brushing harder doesn't mean brushing better. Let me ask you a simple question. When you want to remove a stubborn stain from your kitchen counter, what's your first instinct? Most people scrub harder. That works for countertops. It doesn't work for gums. Your gums are living tissue. They're soft, delicate, and they aren't designed to be scrubbed like a dirty pan. Yet every day, I watch patients grab a toothbrush, press as hard as they can, and move it back and forth as if they're sanding a piece of wood. When they finish, their teeth feel smooth, so they assume that must be the right way. But here's the problem. Cleaning your teeth isn't about force. It's about removing plaque. Plaque is soft. It doesn't require aggressive scrubbing. In fact, using too much pressure can slowly irritate the gums. Over months, sometimes years, that repeated trauma may contribute to gum recession in some people. I often tell my patients, if your toothbrush bristles flatten after only a few weeks, you're probably brushing much harder than necessary. Healthy brushing should feel gentle, not painful, not exhausting, not like you're fighting your toothbrush every morning. But pressure isn't the only problem. There's another mistake, and it's even more common. It has nothing to do with how hard you brush. It has everything to do with how you move the toothbrush. Mistake number 2, scrubbing back and forth. Imagine washing a delicate silk shirt. Would you attack it with a wire brush? Of course not. You'd clean it gently. Your gums deserve the same respect. One of the most common brushing habits I see is a fast back and forth motion. People move the toothbrush horizontally across the front of their teeth over and over again. It feels productive. It even sounds productive. But your toothbrush isn't a saw. Those aggressive horizontal strokes repeatedly rub against the gum line. Over time, they may contribute to irritation, especially when combined with excessive pressure or a hard-bristled toothbrush. Instead, I recommend using small, gentle, circular motions. Think of it as massaging your gums rather than attacking them. The goal isn't to scrub. The goal is to remove plaque while being kind to the tissues that support your teeth. Sometimes the smallest change in technique can make the biggest difference. Most people believe choosing the right toothpaste is the most important decision. Surprisingly, your toothbrush may matter much more, and that's where we'll go next. The brushing mistake that pushes your gums back. Most people spend a lot of time choosing the right toothpaste. Whitening, sensitive teeth, extra fluoride, charcoal. But here's the surprising part. The toothpaste usually isn't the biggest problem. Sometimes it's the toothbrush itself. Mistake number 3, using the wrong toothbrush. A patient once held up his toothbrush and proudly said, "Doctor, I bought the firm bristles. They clean much better." I smiled because I've heard that sentence hundreds of times. It sounds logical. Stronger bristles should clean better, right? Not necessarily. Plaque is soft. It doesn't require stiff bristles to remove it. What stiff bristles can do, especially when combined with heavy pressure, is place extra stress on your gums. Imagine washing your face with a kitchen scrub brush. Your skin wouldn't thank you. Your gums feel the same way. For most people, a soft bristled toothbrush is all that's needed. Used correctly, it removes plaque just as effectively while being much gentler on your gums. The goal isn't to brush harder, it's to brush smarter. But even with the perfect toothbrush, there's another mistake that quietly damages gums every single day. Mistake number 4, rushing through the job. Be honest. How long do you usually brush? 30 seconds? Maybe 1 minute? Most people believe they brush for 2 minutes, but when we actually measure it, they're often surprised. 1 minute feels much longer than you think. When people rush, they naturally scrub faster. They miss areas behind the back teeth, they forget the gum line, and they almost always ignore the inside surfaces of the lower front teeth. That's where plaque loves to stay. Instead of brushing faster, slow down. 2 minutes isn't very long. It's about the length of one favorite song. Give each section of your mouth the attention it deserves. Your gums notice the difference, even if you don't immediately see it. Now here's something that surprises many of my patients. Sometimes the damage isn't caused by brushing, it's caused by what happens immediately afterward. Mistake number 5, ignoring the first signs. Your gums are asking for help. Imagine your gums bleed one morning. You notice a little pink in the sink. You tell yourself, I'll keep an eye on it. A week passes. It's still happening. Another week. Still there. Months later, you're sitting in a dental chair asking, Doctor, why are my gums pulling away? Our bodies are remarkably good at sending early warning signs. The challenge is, those signs are usually small. A little bleeding, a little tenderness, a little sensitivity, nothing dramatic. That's exactly why they're easy to ignore. Healthy gums rarely bleed day after day. They rarely stay swollen for weeks, and they rarely become sensitive without a reason. When something changes, pay attention. You don't have to panic. But you also don't have to pretend nothing is happening. Small problems are usually much easier to manage than large ones. We've covered 5 common brushing mistakes, but there are 2 more. One is made by millions of people every single night, and the last one might completely change the way you brush your teeth starting tomorrow. The brushing mistake that pushes your gums back. We've talked about brushing too hard, using the wrong toothbrush, rushing, ignoring early warning signs. Now, let's finish with 2 mistakes that many people make every single day without realizing it. Mistake number 6, replacing your toothbrush. Too late. Take a look at your toothbrush. Right now, how do the bristles look? Are they standing straight or are they bent in every direction? Believe it or not, your toothbrush can tell a story. A toothbrush with frayed bristles doesn't clean as effectively. Instead of gently sweeping plaque away, the worn bristles simply slide over the surface. Many people keep using the same toothbrush for 6 months, sometimes even a year, not because they want to, because they simply forget. Here's a simple rule I share with my patients. If the bristles are bending outward, it's time for a new toothbrush. For most people, that means replacing it every 3 to 4 months, even sooner if you've recently been sick. A fresh toothbrush isn't about buying something new, it's about giving yourself the best chance to clean your teeth effectively every single day. And finally, there's one mistake that surprises almost everyone because it has nothing to do with your toothbrush. Mistake number 7, thinking brushing alone is enough. Imagine cleaning only the outside of your windows. From the street, your house looks spotless, but inside, the glass is still dirty. That's exactly what happens when people rely only on brushing. Your toothbrush reaches 3 surfaces of each tooth, but it can't effectively clean the tight spaces between them. That's where plaque often stays the longest. Over time, those hidden areas become the perfect place for bacteria. And bacteria don't care how expensive your toothbrush is. They only care whether they're removed. That's why floss, interdental brushes, or a water flosser are such important parts of a healthy routine. You don't have to use every tool. You simply need one method that allows you to clean between your teeth consistently. Many patients tell me, Doctor, I brush twice a day. Isn't that enough? My answer is always the same. Brushing is essential, but brushing alone isn't a complete cleaning routine. Think of it this way. Your toothbrush cleans the rooms. Floss cleans the hallways. You need both. So, what's the right way to brush after everything we've discussed today? Let's keep it simple. Choose a soft bristled toothbrush, brush gently, use small circular movements along the gum line, take a full 2 minutes, clean between your teeth every day, replace your toothbrush every 3 to 4 months, and pay attention if your gums begin sending you warning signs like bleeding, tenderness, or recession. None of these habits are difficult, but together they can make a remarkable difference over the years. Before we finish, I'd like you to try something tomorrow morning. After brushing, run your tongue gently across your teeth. They should feel clean. Now look at your toothbrush. If the bristles are already flattened, or you're gripping it so tightly your hand feels tense, try using about half the pressure tomorrow. You might be surprised. Your teeth will feel just as clean, while your gums will thank you for being a little gentler. Sometimes, better brushing isn't about doing more, it's about doing less. One of the biggest myths in dentistry is that stronger brushing creates healthier teeth. In reality, healthy smiles are usually built through gentle, consistent habits repeated every single day. Your gums don't need force, they need care. If today's video changes the way you brush your teeth, even a little, then we've accomplished something valuable together. Thank you for spending these few minutes with me. If you enjoy practical dental advice explained in simple, everyday language, I'd be honored to have you join me by subscribing to the channel. I'm Dr. Daniel Brooks. Take care of your gums, because they protect every smile you'll ever have.